Hello, this is Naturopathic Dr. Chris Habib. I have the pleasure of sitting here with Dr. Christine Matheson, Naturopathic Doctor, an expert in naturopathic medicine who's been in practice for 13 years. She's worked in family medicine, and also she works with pelvic and abdominal health as well as pediatrics. Dr. Matheson, thanks for chatting with me today.
Thank you for having me.
So we're going to ask you a few questions to clarify some information for our viewers. The first question that we have is, what are some types of common concerns that patients have in these areas?
Well, I think that one of the great honors of working as a naturopathic doctor is that we, many of us choose to operate what I would call a family practice, which means that we get the pleasure of seeing all members of the family eventually. Sometimes it starts with one member of the family. So I would say a large majority of my patients are women who come at a point in their life where perhaps they want to simply enhance their health, improve their hormonal health. They may have digestive health issues, and often if there's gynecological issues, we can help address that if it's endometriosis or uterine fibroids. And sometimes, not always, but the journey leads to their desire to have a child. And so we're preparing them for conception and enhancing their fertility. And then obviously guiding them through a healthy pregnancy, healthy birth, and then being able to guide them through a postnatal stage and being able to help them raise healthy children. As a mother myself, I enjoy being able to take the wisdom that I not only have as a naturopathic doctor, but my experiential knowledge as a mother and what I've decided to utilize to enhance the health of my children. And so be able to do that has been a great pleasure. And so then often dad might come in, or grandpa or grandma, because the whole family is looking to enhance their health. And so that is can open up many things. It could be arthritis, it could be stress management, it could be that they're dealing with other types of hormonal issues like thyroid or adrenal, and you know, the range is quite broad in that sense.
Definitely. Wow. So it really sounds like you serve the whole family throughout different life stages as well.
Sometimes. And sometimes I'm working with an individual patient who may have a different kind of family or be single, and I've worked with many people at different points in their life, like a family doctor would, but using all natural medicines.
Excellent. So then how exactly would a naturopathic doctor help with these conditions?
So naturopathic medicine, in my view, can and should be safely integrated with the conventional care that's available to patients. I believe in an integrative approach, but I think what naturopathic medicine can bring is a holistic approach. And holistic to me means a couple of things. It means that we are honoring that there's a connection between all the systems of the body. So if someone's coming in to see me for one specific concern, for instance their skin, I may really ask lots of questions about their skin, but I want to know how their digestive system is working, how their stress management is, because all the systems of the body connect. And one system that we do really particularly honor is the mind, and therefore honoring that there is a connection between the mind and the body means that we look at how well patients are adapting to stress and making sure that stress and their way that they're managing it is not impacting their health, that maybe they may need some more strategies. So in terms of holistic, that means that you're really taking a balanced view and a more whole view of a person in terms of their health. And then as a naturopathic doctor, what we're also using is the principle of always trying to treat the root cause. So trying to, as much as possible, see what is the underlying reason so that we can not just suppress a symptom temporarily, but address it. And our hope through that is to tailor the treatment to the individual. So making sure that we're really individualizing it, and making sure that that person on the way to feeling better is feeling full of more resources. So the idea being education, to allow that person to feel more in the driver's seat of their health. And then of course, the method through which we're helping them are all natural therapies. So nutrition is a step you never can miss, looking at what you eat, how well you're absorbing it. An extension of that could be nutritional supplements, either temporarily or for longer periods of time. And then herbal medicine, plant medicine, which can be used externally or internally. as well as homeopathic medicine, which requires more of an abstract way of thinking, but is the use of diluted substances to create an energetic effect on the body. Traditional Chinese medicine and acupuncture, and then for me, I utilize a technique called Maya abdominal massage, or I may refer within my clinic for other hands-on techniques. And then last but not least, stress management.
Wow, perfect. So you've got quite the varied tool belt then for anything that walks through the door.
Yeah, exactly. And part of the reason I chose to be a naturopathic doctor was I wanted to have a range of therapies available to me for a couple of reasons. Because some people's bodies and personalities resonate more towards one therapy or another. And at different points in their health journey, they may need to switch therapies and try different ones. So it's great to have a range available.
Excellent. So let's say someone wanted to come see you in your practice. What could they expect at a visit?
So in my initial visit as a naturopathic doctor, I really am focused on getting to know the patient. So it's the intake appointment, and we focus on getting to know what has happened in the past in terms of a health history, anything regarding their family health history, and their present lifestyle. I want to know a lot of detail about what is happening for them fitness-wise, diet-wise, stress-wise, and then we're looking at what are their health goals. So sometimes patients, it's wonderful to have an opportunity when a patient is simply coming in to enhance their health, where they want to promote or optimize their health so they don't have a major concern, but they want to really enhance further. But often patients do have a few small concerns or major concerns that they're coming to you for. So that's when we delve deeply into finding out the details of what makes their symptoms very specific, what characterizes them. And so the first appointment is about that and getting to know as much as possible. And if any initial thoughts or treatments come to mind that I think they could start on right away, I will suggest them at the first visit. But generally I reserve a treatment plan which I've researched and reflected on and contemplated to make sure I'm really practicing treating the root cause and taking an individualized approach. I prepare that for them for their second visit, which is an hour-long visit, which is a lot of information sharing, where I'm giving them resources and ideas and suggesting not just what to do, but why I think it could be useful for them, so that they understand the reasons why, so they feel more part of the relationship with their health, so that we feel in partnership in taking care of their health. And then the idea is that they take away that appointment and try to really implement some of these changes slowly and gradually in their life. And then we're monitoring, depending on the case, it may be more frequently or spacing it out every few months to see how they're doing. And one other thing is we like all of our naturopathic patients to have a physical exam done. So that usually occurs right after the first visit, and we make sure that's part of the research gathering process as well.
Wow, that's extremely thorough and amazing. I think that's how healthcare should be.
Yeah, I think when you do embrace a holistic approach, it does bring a certain level of detail, but that does make it more individualized, and that's what makes it sometimes more effective for some patients, that they feel it's really tailored to them and specific for them.
Excellent. Well, Dr. Matheson, thank you so much for chatting with me today.
My pleasure.
I'll just read off your contact information here. So Dr. Matheson can be found in Midtown Toronto at Mahia Forest Hill. The website is mahiaforesthill.com, and the phone number is 416-792-4400. Dr. Matheson, thanks again.
Thank you.